Welcome to Psychology Daily. We begin the new week and it's about addictions. Addictions is a very difficult topic to talk about because in many cases it is related to more complex problems. For example, today's video is about substance use disorder as a consequence of military sexual trauma. Military sexual trauma is widespread among military personnel and veterans, and approximately 16% of them report being a victim. Moreover, percentage is higher among females and males, 38 and 4% respectively. Military sexual trauma is linked to numerous negative consequences: increased rate of PTSD, depression, anxiety, substance use disorder, and suicide rates. This video is about relationship between military sexual traumas and substance use disorder, both alcohol and drug. Study conducted by Simon Goldberg and colleagues tried to answer the question to which extent military sexual trauma increased alcohol and drug disorder rates separately. To do so, they analyzed data of more than 400,000 veterans from Operation Enduring Freedom and Operation Iraqi Freedom conflicts. They included in analysis alcohol separately and alcohol and drug use disorder combined up to 5 years after service. The military sexual trauma was measured by two questions. While you were in military, did you receive uninvited and unwanted sexual attention, such as touching, cornering, pressure for sexual favors, or verbal remarks? Did someone ever use force or threat of force to have sexual contact with you against your will? If person responded even for only one question with yes, then he or she was considering to have military sexual trauma. Results shows that 1% and 1.1% of males with alcohol and drug use disorder, respectively, had military sexual trauma, while as many as 21.8% and 23.0% of females reported same trauma. Among female veterans, prevalence of alcohol use disorder was more than doubled among those screening positive for military sexual trauma. Prevalence of drug use disorder was more than doubled too in females. Rates for males for alcohol were 12.5 versus 18.2 for alcohol use disorder and 10.8 and 20.9% for drug use disorder. Finally, risk of substance use disorder among women screening positive for military sexual trauma was larger for alcohol use disorder than for drug use disorder. Military sexual trauma is related in increase in both alcohol and drug use disorder, and alcohol use disorder is more prevalent. I hope you enjoyed this video. See you tomorrow.